when to test, when not to test, and what test to do. In this video, we are going to answer these three things. Also, if you don't know the difference between second wave and first wave of COVID-19 pandemic, check in the I button the video we made previously. Namaste, this is Namaste from Second Wave Ep.1 and this is episode 1 of Understanding Second Wave. So let's start. So first question, when to test for COVID-19? If you have any symptoms from this list, you have to test. The symptoms are fever, body aches, loss of smell and taste, loose motion, chills, hearing impairments, and breathlessness. If you have any symptoms from this list, you have to test for COVID-19. And if you bring close to a COVID-19 positive patient for more than 50 minutes and your distance was 6 feet less, then you have to test. Now, when not to test, if you completed your second dose and if 2 weeks have passed after the second dose, you don't have to test for COVID-19. If you don't have any symptoms, even after the contact with COVID-19 patient, you don't have to test for the COVID-19. So basically, if you are vaccinated, you don't have to test after 2 weeks, and if you don't have any symptoms. So you have symptoms from this list. Now, what test to do? There are 2 tests available. First is RT-PCR and rapid antigen test. Rapid antigen test gives faster results, and there are also guidelines for this. RT-PCR is gold standard for COVID-19 test, which take time, and rapid antigen test is quicker way to diagnose. Now, in rapid antigen test, if your test is positive, the COVID-19 confirmed. But if the rapid antigen test negative, you still have to opt for RT-PCR test to be sure fully to the extent. Now, sometimes what happens if our rapid antigen test comes negative but RT-PCR test comes positive? In that case, you have COVID-19. So these are the 2 tests you have to opt for according to these guidelines. So what happens after this test is, in the RT-PCR report we get CT value. Now, often people confuse between CT value and CT score. There are 2 different things. CT value is cycle threshold value, which means that it diagnoses the intensity or the severity of COVID-19 infection. Lower the CT value is, higher the risk and intensity and risk to your life of COVID-19 infection. Then CT score is obtained after the CT scan, which is after the guidance and advice of doctor. After the CT scan of chest, you get CT score. Higher the CT score is higher the severity or higher the intensity of COVID-19 infection. So that means higher the CT score is higher the risk of your life after the COVID-19 infection. So these are the 2 types of tests you have to do according to their guidelines. Also, get advice from the doctor, your family doctor or any nearby doctor. Then another bonus tip is that follow the precautions. You don't have to do this test if you don't have any symptoms, or even after test yourself after the close contact of COVID-19 patient for longer than 50 minutes, and if your distance is less than 6 feet. Now, if you are vaccinated after the second dose, you don't have to opt for this test. You are completely safe. You can get fever, you can get small symptoms, but that are totally okay. Check the video in the I button for the more details. Now, that's for the video. If you like it, please like and subscribe. Follow the COVID-19 precautions, wearing masks, following social distancing, and washing your hands regularly and using hand sanitizer. So that's for the video. This is the episode 1 of Understanding Second Wave, which is a 3-episode series by Second Wave Ep.1. And on the second episode, we are going to take over the stages of COVID-19 infection. So stay tuned for that. Subscribe to the channel, press the bell icon, comment what your thoughts, and Namaste. This is Namaste from Second Wave Ep.1 signing out.